Namaste viewers, welcome to the Facebook live session. Today's topic for discussion is common hand injuries and how to treat them. And for our discussions, we have with us Dr. Gopinath Bandari, consultant and wrist and reconstructive microsurgeon at Apollo Hospital, Jubilee Hills, Hyderabad. Welcome, doctor.
Thank you.
To start with, doctor, what are the most common household hand injuries while performing day-to-day activities?
Yes. To start with, I'm Dr. Gopinath Bandari, consultant hand, wrist and microsurgeon at Apollo Hospital, Jubilee Hills. And today we are going to talk about the common household hand and wrist injuries and the common hand issues we all face with. So, as you have asked the question, the most common household injuries which we see in day-to-day activities are usually women who are doing their regular works in the kitchen, like cutting vegetables and cutting using the knife sharp objects. They are prone for cut injuries to the hands and fingers, which probably in the starting may seem to be a very minor issue, but that can be severe tendon and nerve injuries also. So if these injuries are neglected, that can lead to severe dysfunction of the hand. And similarly, a lot of women who do not take proper care while doing grinding vegetables or grinding mixer grinders, they put their hand in the mixer grinders, and because of that they are prone to mixer grinder injuries. So these mixer grinder injuries can lead to complete loss or amputation of the fingers and fingertips, which can be very detrimental to the hand function. Similarly, we can see other injuries in household like children and toddlers who are going around and putting accidentally their fingers in the doors. This can lead to door crush injury of the fingers. Because of this, lot of fingers are getting amputated, and if proper care is taken, we can preserve the length of the fingers and sometimes save the fingers also. And the next common household injury is the gardening injury, where people who are not trained or accustomed to activities like gardening have injuries while doing gardening by sharp objects, shovels or knives, etc., which are used for gardening tools. So these people may be prone for getting their fingers cut and amputations also. So these are the most common household injuries which we see within the house.
Thank you, doctor. Doctor, how to treat these injuries, doctor?
So these injuries, first of all, should not be considered as minor injuries, because though superficially they seem to be minor injuries, they can be very severe. They can be deep, they can be having nerve injury, tendon injury, vascular injuries, and they have to be should not be neglected. They have to be evaluated by a proper hand specialist, and the hand surgeon will suggest the treatment according to the severity of the injuries. Some superficial injuries can be treated by minor dressings, but deeper injuries and amputation, crush injuries, they need immediate surgical intervention to restore proper anatomy and to give back proper function. So by surgical or by simple mechanisms like dressings, and also we can get back to normal lifestyle by depending on the amount of damage has happened.
Doctor, what are the different accidental and occupational injuries that are common?
Yeah. So again, accidental injuries due to road traffic accidents and motor vehicle injuries is a different entity, whereas occupational injuries is a different entity. So coming to road traffic accidents, usually people are prone to road traffic accidents because of high velocity and high speed, rash and reckless driving. Most commonly because of fall from the bike and fall from a running vehicle. These people are prone for traction injuries, which are a part of polytrauma, and these can cause injuries like as brachial plexus injury, causing the entire upper limb to be paralyzed for life unless we intervene. So this is another spectrum of hand injuries, and many a times people are injured in crush injuries of the hand, crush injuries of the upper limbs or the lower limbs. So these are the different types of injuries because of motor vehicle incidents. But occupational injuries to the hand and wrist are different. For example, software engineers, these people are continuously using mouse and keyboard, and because of that their carpal tunnel is at risk. The carpal tunnel is having a lot of pressure in these patients and they develop carpal tunnel syndrome. Similarly, manual laborers who are using drill activities, these people are prone for, again, because of repetitive stress injury, the tunnel is and the nerve tunnel is overloaded and the nerve is compressed. So occupational injuries can be because of such sort of a repetitive stress injuries. And the other spectrum of the occupational health hand hazards is because of different type of material used in the occupation, like poisonous chemicals causing burns to the hand, or electric shock to the hand, or sharp objects and drills which can cause amputation of the hand and crushing of the hands. So these are all the different types of occupational and accidental injuries which we see in the hand and wrist.
Doctor, but how to treat this different accidental and occupational injuries, doctor?
So any accidental or occupational injury have to be immediately rushed to the emergency department. There emergency specialist will see, and if any intervention is there from the hand surgeon, meaning any hand injury or any wrist injury is present, they will be referred to the hand specialist, and even people should ask for a hand specialist so that they can get the proper adequate care which is needed for the hand surgery. So based on the amount of damage involved, we would assess them and take for surgery immediately, and depending on the amount of crush injury, we either take off the amputated parts or replant the amputated parts if at all necessary, and also reconstructed the parts if their replantation is not possible. So also we do small types of flap surgeries to the fingers or fingertips so that the fingers can be made functional. At the same time, brachial plexus injuries because of the accident also need a very schematic protocoled regimen of treatment, which may include in a staged surgeries in a staged procedure. So all of these have to be done by a hand surgeon, and it has to be a proper follow-up and a proper treatment. Surgical treatment is necessary for such injuries.
Doctor, there's one more question, like why do our fingers click? Is it good sign or a bad sign, doctor?
Yes, first of all, fingers clicking is a very common thing. Everybody also, a lot of people do have habitual clicking, and these are just because of gases in the joints. This is a very normal and natural phenomenon, nothing to worry. But the second entity is locking. Locking is different from clicking. Locking can be something called a trigger finger, which causes locking of the fingers while moving. So when the fingers are moving, the finger gets locked in such a position. So that is a different entity, and this is not clicking. Clicking of the fingers happens in the joints. These are just some sounds which happen when we click. But locking happens in the normal movements, and the finger automatically gets locked and it does not get open, or sometimes on pressure opens with a snap. So this is called a trigger finger.
Like who are prone to this kind of clicking and locking fingers, doctor?
Yes, so locking of fingers or the triggering of the fingers are commonly seen in two varied age groups. One is congenital. That means when children are born with certain such deformities, it is called a congenital triggering. This is more common in thumb. So congenital trigger thumb, children are born with a bent thumb. So most of the times the parents do not notice until the child is of 2 to 3 months that the thumb is bent and it is not getting opened. So after 2 to 3 months, mostly the parents notice that the thumb is not getting straightened. That is the time they usually present to us, and these sorts of congenital trigger thumbs have to be immediately released, otherwise the thumb may be prone for a permanent deformity. So that is one age group for congenital trigger thumb. And then the other age group is usually seen in the very elderly age group of people more than 50 to 60 years of age. These people, they have diabetes, hypertension, and or hypothyroid or rheumatoid arthritis. These sort of multiple comorbidities where the tunnel through which the tendons of the fingers pass, this gets tightened, and that is the reason triggering happens. So there are two age groups for triggering. One is the congenital, that is the newborn babies or pediatric age group children, and second is the adult, very severe elderly age group people. These two age groups are commonly affected by triggering.
How to treat them, doctor?
Yes. So if we come to know about what actually triggering is, so what happens while moving the fingers? Every finger has a tendon going to the finger. So this tendon passes through a small tunnel at the base of the finger. When this tunnel gets tightened, then the tendon passing and gliding through the tunnel becomes tight, and that is when triggering happens. So in the early stages of triggering, when it is in a pre-triggering stage, we will be able to manage by simple massages. If not, in a pre-triggering stage, if the massage is not getting relieved, we can give small injection steroid shot into the tunnel. And in late stages where the triggering is very painful and constantly triggering, the easiest, simplest solution is to release the tunnel so that the triggering gets vanished immediately within a minute after surgery. So it's a very simple procedure which can be done as a out clinic procedure, as a daycare procedure, wherein a patient can come, have the surgery done and go back immediately without much discomfort. Similarly, in the pediatric age group also, for congenital trigger thumbs, the small tunnel which is tight will be excised during the surgery, and the thumb can be straightened in the pediatric age group also. So this is a very simple way which we treat triggering of the fingers and thumb.
Why do some people have a severe pain or tingling or numbness in hand, doctor?
Yes. So tingling and numbness in the hand can be multifactorial. There are many causes for tingling and numbness, and it can be originating in the fingers itself, it can be originating in the wrist level at the carpal tunnel, or it can be originating somewhere above in the elbow level, or it can go anywhere up to the neck level. So anywhere the nerves are compressed or irritated, these tingling and numbness can happen. If the most commonly what we see is the cervical radiculopathy, where the nerves are compressed in the neck, and that causes tingling and numbness of the entire hand. But what is the one which we most commonly see, commonly caused by commonly caused in software engineers, like using mouse and keyboards, is the carpal tunnel syndrome, where the median nerve gets entrapped in the carpal tunnel and they face severe pain and tingling numbness in the fingers. That is called carpal tunnel syndrome.
And how to treat it, doctor?
So as I said, carpal tunnel syndrome, the median nerve passes through a small tunnel in the wrist. So when the median nerve is passing through this tunnel, it becomes tightened. Because of the tightening, the numbness is persistently seen in thumb, index and middle fingers. So in such conditions, when the complaints are very mild, we can manage with some medications and nighttime splinting, because pain is severe in the night. But when the pain becomes worse and it is not getting relieved with medication and splints, that is the time we need to operate, and we do the surgery with a small 1 centimeter incision or a 1 inch incision, either by endoscopic technique or by open technique, and release the carpal tunnel and release the nerve so that the symptoms disappear. So this is how a carpal tunnel syndrome can be treated by a simple surgery. It's a daycare procedure, and patient will be able to get back to normal within a couple of days.
Doctor, earlier you have sharing it with us with people using laptops and all. So nowadays, due to excess usage of laptop, mouse or holding phone for hours, so movement disorder are common. How do we combat them?
Yeah. So because of prolonged usage of laptops and mouse, keyboards, and even phone, the hand wrist joints are affected, and we are seeing a lot of incidents of such complaints in the software engineers. So we can prevent such repetitive stress injuries by taking proper breaks in intervals and getting off the keyboard and mouse, doing some exercises for the wrist so that the wrist ligaments are toned and the nerve is not stressed. And if the symptoms are more, we also advise a vertical mouse so that the wrist ligament is not a stress when we are using the mouse, and the carpal tunnel is not at stress when we are using the mouse. So that is the time we use vertical mouse and vertical keypad, so that the tunnel and the nerve will be free, and at the same time the people will be able to do their day-to-day activities and computer jobs.
Doctor, regarding finger clicking and tickling, as you have said, after implanting a fix or fixing them, can the functionality be like before?
Yeah, after trigger finger surgery and all, the function can be completely normal. 100% of result can be achieved after the trigger finger release.
And what is the emergency care or first aid to be done at home if any finger or wrist injury occurs?
If there is any heavy bleeding after any finger cut or a wrist cut, we have to apply proper pressure, apply some ice. If available, we put a sterile bandage and then rush to the emergency department for proper care. That is the thing you have to do at home. Sometimes when there is a complete amputation of finger or a body part, then the first aid you have to do is put that amputated body part in a plastic cover or an aluminum wrapper, and then that package has to be put in an ice box. That ice box has to be transported to the hospital within 4 to 6 hours after injury. The part has to be replanted within 6 hours after the injury. So early arrival to the hospital is mandatory for a successful replantation.
Doctor, could you also tell us different services that are offered for hand and wrist injuries at Apollo Hospital?
Yes. So we are successfully conducting the hand, wrist and microsurgery clinics in the Apollo Hospital, Jubilee Hills, serving different conditions in the hand and upper limb, starting from basic hand trauma to very advanced and complex hand trauma and disorders, including wrist arthroscopy techniques, which include minimally accessible keyhole surgeries for the wrist ligaments and wrist injuries. And secondly, brachial plexus surgeries who have paralyzed upper limbs because of brachial plexus injuries. We do nerve transfers, nerve repairs or nerve grafting procedures or any secondary procedures. Third is congenital hand differences, where children born with abnormal hands during birth, those also people can be treated by different surgeries. Also, nerve and tendon reconstruction can be done. Electrical burns to the hand and post-burn contractures of the hand can be corrected, and various deformities of the hand can be corrected. So these are all the different types of services we are providing at the hand, wrist and microsurgery specialty clinics at Apollo Hospital, Jubilee Hills.
Dear viewers, we have come to our end of our discussion and hope we have covered all aspects. If you have further doubts, you can book an appointment with Dr. Gopinath Bandari, either through a physical appointment or an online appointment. The link is given in the description. Thank you, Doctor,
Thank you
for educating our audience in today's discussion. Thank you, audience. Stay tuned for more such educative sessions. Namaste.
Thank you.